Thank you for staying with us on Sunday Live. As promised, I'm joined by Bessie Nikosi, who is Social Protection Lead, Oxfam, Kenya, and Ahmed Ibrahim, who is convener, ASL Humanitarian Network, and Oxfam's partner in humanitarian projects in northern Kenya. I'll start with you, Bessie. Tell us a little bit about the work that Oxfam does, and then what you do as Social Protection Lead.
Thank you. Thank you for having us. So as Oxfam, our DNA is in the humanitarian space. But over the years, having done humanitarian work, we realized that there are structural issues, underlying issues that need to be addressed in order for us to reduce the vulnerabilities that impact on people, especially during crisis. So apart from the humanitarian work that we do, we realized that we need also to look at system strengthening, approaches that actually look at climate justice, gender justice and women's rights, and governance and accountability, to be able to ensure that even as we do the humanitarian support, that we have also looked at the structural inequalities that create vulnerabilities. As Social Protection Lead, what I look at is basically any instruments that can be able to support communities, to be able to withstand shocks. So looking at anything that looks at building the capacities of communities to be able to be strong enough or resilient enough in the face of crisis. And the social protection space is very wide. When you look at it from the formal instruments of social protection, we have social health. SHA would fall under that category. NSSF also falls under that category because it looks at cushioning people after they leave work, yeah. Social assistance, which is very synonymous with social protection, which looks at the cash transfers, yeah. Programs like the HSNP by the government, hunger safety net program by the government, that is a form of social protection. And then we have also the social protection programs social protection that is considered less formal. Even Harambe is a social protection because the community is cushioning another member of the community against a certain crisis. Yes.
That's a lot. Yeah. that encompasses a lot,
yes.
Right?
Yeah.
So how do you achieve all of this? You work with partners?
Yes, we do. Ahmed is here. He'll talk a bit about ASL Humanitarian Network. But over the years, we realized that we can't be everywhere. Yeah, so we've cut down our operations from having hundreds of staff down to less than 40, ceding space to local humanitarian organizations, CBOs, the communities themselves. Yeah, so our operations have gone towards being more efficient because when you work with partners, for example, AHN currently has 30+ partners, yeah, and they're bringing in more to the fray. You're able to reach the most hard-to-reach areas, and working with local partners who understand the context very well and are able to give humanitarian support in the best way possible, as fast as possible, because they're right there in the middle of it all. Yeah, so that is the one of the ways that we work. We also work a lot through the systems, the government systems that have been put in place. Work a lot with governments, county governments. We have very technically sound government officials that we work with, very dedicated. And of course, for sustainability's sake, you also have to work through these structures to ensure that whatever you do has a lasting impact. And another thing that we do that I would like to mention is around testing models that can be handed over to the government to work on. For example, I'm not sure if you know that Oxfam is one of the organizations that piloted the Hunger Safety Net program.
Oh, wow, I did not know that.
Yeah, so we piloted the Hunger Safety Net program, and then it was handed over to the government to be done at scale. So that's another model that we use, testing models. And once we have a proof of concept, being able to hand that over to government bodies or even local organizations that can be able to take it forward.
Okay. So now I'll ask you, Ahmed, because you're on the partnership end of things. You talked about, did you talk about 30 partners under?
30 plus.
30 plus under AHN, the ASAL Humanitarian Network. How does this model work?
Thank you very much. And ASAL Humanitarian Network, as the name suggests, came together first in 2019. Was just a loose setup. It's made up of 30 initial founding agencies. But in 2015, when the devolution came into place, the local actors in the ASAL space came together to really analyze what civil societies should be doing. And during that kind of an analysis, we did a convening and got an external person to convene us. We were able to look at the space civil society needs to play in a devolved government system.
And what is that? What is it
so
that, what role is that civil society should be playing?
So the four things that we identified at that moment was for it to really work well was to really have active citizens who can be able to participate, be part of planning and budgeting processes, and can be able to hold as rights holders their government who are duty bearers to the priorities and needs of they came up with. The second one we identified was that women really had little say in most of the things. They were not economically empowered. They were not able to make decisions. They were not part of even the aspects of leadership in campaigns. They were very low. So that was the second thing we saw. The third thing we saw in the ASAL areas was that if there was no peace, there's no security, and therefore there's no development. And where there's no development, then you cannot be able to really have peace and security. So from that kind of perspective, we looked at it and then said, what is the next level? So when the devolution setup came into place, we were looking at, in the Constitution, there is something about equalization fund. So we said there's need to really apply an equalization fund across a number of counties which are below in development, which are not equitably developed. And we were looking at that time, the only way to really get the small micro work that is being done by counties to be scaled up was the need to really come up with the economic blocks as at that time. And it's good to know that around 8 or something like that are now in existence. And largely, that equalization fund, as it is today, is not being implemented in line with the Constitution and the way it was supposed to be at county level. Now it's been done all the way at sublocational level. So it is so fragmented that there are small pieces of jobs. Now the ASAL Humanitarian Network in 2019 now looked at it and said, as local actors, we are in the front line, we are seeing crises coming up, and we really needed to take these actions first. And we approached a number of like-minded agencies, including Oxfam, to be able to now take the bull by the man to ourselves. Instead of waiting and being partnered with, we made ourselves a partner of choice. So we came up with harmonized models, and with those harmonized models, walked the steps slowly. So when we started that kind of activities, Oxfam, as we speak today, by the time it was in 2019, it was only working with 2 members of the ASAL Humanitarian Network, who have been partners with Oxfam since 1995 or 1999, one of them. So as we speak today, Oxfam is partnering with 14 of those members, but a number of other organizations have also done that. So we work on harmonized models. Harmonized models in the context that we want to showcase things that can be done at scale as well. So for example, the cash transfer programming, we have an 8-step model, which entails coordinating with the government to be able to identify localities which are in crisis, to be able to really do the process to a level where the 14 organizations are already infrastructurally ready and are having Safaricom M-Pesa mechanisms, which they can do with a click of a button to send money to 20,000, 10,000 households at once. The second other one we have partnered with Oxfam to be able to do is what we call an e-voucher mechanism. And it's still using a Safaricom model. And what it's doing is using a market-based approach where a young lady who is in her reproductive age should be able to find a sanitary pad in a shop at the lowest level in the village, if it's possible, and also the NFIs that are needed in that space. We also work in the space of gender and protection, wash, water, and a number of things. But some of our members also work in peace building. They work in climate change space. We work in health. They work in gender and protection. They work in quite a number of diverse kind of sectors. So the ASAL Humanitarian Network largely is amplifying voices of communities and the members. The second bit we are doing is to bring localized action into effect, and then partnering with stakeholders to be able to have an effective aid system that works for people in crisis. So that, in a nutshell, is what the ASAL Humanitarian Network does.
All right. Bessie, over the last couple of weeks, we've been carrying some special reports. One, Lilian Muli was in Turkana, and some of what and you know, the tragedy that happened there. And in her, when she was signing off with that report, and that is the lives that were lost there, the fishing community and how it was affected. And she mentioned that it looks like these humanitarian organizations are stepping in where government ideally should be operating, because if that is not a viable form of economic employment, there were alternatives. Women, for for also being taught how to bake, taking part in such activities. What do you say to that?
As humanitarian organizations, we can never usurp the role of government. They are the duty bearers in this space. We only come in to complement what they're doing. So first and foremost, in matters security, of course, we cannot come in. Maybe the peace building efforts that we usually do, that we can do as we do the other humanitarian work that we do. So that the role of government cannot be sidestepped. Yeah, and over the years we have seen a very transformative change within the humanitarian sector. So a lot of it has been driven by progressive government policies. As the duty bearer and as the force that brings together the different structures and the systems that we need to operate in, we cannot take that role. So even as we do all this other work, we call upon the government to take its place as the duty bearer and as the main coordinating body, to be able to also make the space work for ourselves and for the citizenry, because their main responsibility is towards the citizens of Kenya. Yeah.
So as we look at the humanitarian space, there have been significant funding cuts.
Yes.
How are you managing that?
So the funding cuts, I know a lot of people have started to be privy of the cuts this year because of USAID. But the funding cut started a while back. When Kenya was declared a middle-income country, already we had started to see funding cuts. And then you'll also note that in the region, we are the most stable economy. We are surrounded by many fragile countries. So when there's less resources to go around, people have to prioritize. So prioritization comes, you have to look at protracted crisis in other parts of the globe, where the funding is going, the fragile nations around us. So these cuts have been there, but the USAID, of course, the USAID withdrawal has really precipitated the situation. And so there's this talk about the humanitarian reset. But basically, that's where we are at right now, trying to figure out where we go next. And this is a very good opportunity for us as Kenya to think through how we fund disaster risk management. And there is a bill that has not been enacted, the DRM bill, that should set the foundation, the legal foundation for this. There's a setup of a DRM fund, that should be able to support the gaps that we are seeing.
When you say DRM fund, you mean?
Disaster risk management fund that should be able to plug some of these holes. And when I talk about the government having the role of even coordinating all of us have different pots of funds here and there that we support with. And if we have proper coordination, there should be able to be a pooled fund system that allows us to maximize the little funds that we have. Currently, there's a lot of fragmentation of funding, even within the government, the different government bodies, that if we are able to defragment this and have pooled funding and have proper systems to be able to make the money that we have go further without stepping on each other's toes, we'll probably be in a better space than we are right now. And since the donor funding has reduced, we in country need to look at ourselves and check where are the gaps. Yeah, we have one of the EACC reports from last year talking about around 1.6 million being lost to corruption per day. The DRM fund was looking at around 5 billion. Sorry, it was 1.6 billion being lost to corruption in a day. The DRM fund is looking at 5 billion to start up the funding. So that amount, 3 days of the money that we lose to corruption can fund a whole DRM budget. Yeah? If you come to social protection, the budget that we have this year, 2025 to 2026, is around 41 billion. In that same week, we can be able to fill that gap of budget. You can imagine that 600 million that is lost in a year can fund the DRM budget 120 times, social protection budget 15 times. So we really need to look inwardly and see where can we plug these holes, what can we do differently as a country to be able to serve the citizenry better, and as humanitarian organizations, how can we coordinate better to make the resources that we have go further? Mm-hmm. Yeah.
From the point of view of EHN, the ASAL Humanitarian Network, given these funding crises, where do you, are your partners, the 30 and more that are being onboarded, do they rely primarily on foreign donors, or do they get some money from, for example, counties have DRM budgets?
First of all, as had already been said, this third sector, which is the civil societies, really his role is to complement and gap fill. And it's the responsibility of really the duty bearer to take up most of it. But largely to look at the humanitarian system and looking at what we are calling a grand bargain, we were looking at a situation where decisions are done.
Go ahead. Go ahead.
So decisions are done based on, you see, globally, the number of crises that are coming up are too many. The little money that is collected from the West for the purpose of doing humanitarian action is limited. So the little we get was supposed to be used for a grand bargain internally, where we can be able to get other resources from government, private sector, and so many other community processes to be able to really do these kinds of things. So most of the resources which the local actors we are talking about are having in hand are from external sources. So it's time government steps in, does the real allocation of resources. For example, from last year, the budget of 2023-2024, the analysis from the Auditor General was that out of the 189 billion that was meant for development, around 18 billion went back, which was not spent. And we are talking about 30% of those resources being spent. If you really look at how things are at the county levels, if that 80%, all the 47 counties had enacted the disaster risk management bills and acts and put 2% of that budget aside, we are only talking about how much? 3 billion out of that 80. So in essence, unless we really start thinking about how crises happen and looking at how developmental gains are being washed away by what you are just showing on the impact of the floods, like now in the Tana River Basin, was quite a lot. So from that perspective, we see, so it is critical that if 30% of that money that is in development budget is also being done by service providers, and then you look at the bloating that you are paying around the budgets that are being spent 70% on recurrent costs, you wonder now how best are we going to be doing. But we know Kenya is a low middle income country. It's able to really facilitate these kinds of processes, and it's time we up the game and internally be able to really do this. So local actors who are supposed to be gap filling and doing all this, that money can be used to leverage external resources very well, and we'll be able to do it. But the problem we're having is we're having a lot of very good policies. We're having very good technical people. We have the resources, but when early action is required, and early warning has already been given, no early action is happening. So we are coming at the tail end. And when you start spending at the tail end, if you had acted early with 1 Kenya shilling, you will have been able to save 5 Kenya shillings. So from that kind of a process, there's really need for us to really look at inwardly to be able to resource these kinds of things. Kenya is seen as a front player in these kinds of things, and we are able to really kickstart that kind of a process.
Okay. Bessie, given all the needs you highlighted at the very start, how do you prioritize?
Our prioritization is very simple. We go to the community and we listen to community priorities. Of course, at the very core of what we do, life-saving comes first. So anything we can do to, in terms of life-saving support, that's where we focus first. But you know very well, communities are the first line of response. Before the emergency is declared, these communities are there for each other. They're supporting the most vulnerable amongst them. So even at the point where we come and provide humanitarian support, they've already started, yeah? So working with these communities to know where it pinches most and to know what needs to be prioritized, I think is the only way of doing it and of providing dignified support. Yeah.
Ahmed, many civil society organizations that work in similar spaces, how do you prevent overlap? such that some areas are not forgotten and all the focus is on one area?
In the Kenyan system, there are structures, and the structures up to county level have what we call the county steering groups. In this, any person who comes into a county to do any kind of response first goes for a coordination mechanism meeting, and from there prioritization is already done where the hotspots are. Largely from a government point of view, because every Kenyan is in need in a crisis period, normally that's the only key hindrance from a perspective of doing that kind of a setup. But coordination happens, prioritization is done to locations that are in need, and when we go to the village, still the whole people in the one village are not at the same level. So our reprioritization happens. So we do what we call community-based targeting mechanism. Once the communities do a community-based targeting, then we do a scientific thing called verification. So we look at the food consumption score, we look at the coping strategy index, the dietary diversity, and from that perspective, if a village list which was brought by a community-based targeting process does not reach a threshold of 90% of the people are not in borderline or poor food habits and all that, then we repeat that kind of exercise with the community. Okay. So that is how we avoid the overlaps, and that coordination mechanisms really help to really do that. But whatever we are going to go and do, if you really look at the humanitarian financing mechanism, it was only in 2022 that we got 81% of the resources needed to really do what we needed to do. But thereafter, we are talking about 45% of the needs. So the needs are always overstripping what is available, and that's why it's critical to really do targeting.
All right. And how, when you speak of a community-based targeting mechanism, there are communities, Bessie, that are more disproportionately affected than others, and women are one such group, women and children. Do you give them priority?
Yes, so
the elderly, disabled person.
When you go into a community, there are definitely people who are more marginalized than others. And the perspective of, for example, an elder, a leader in the community, would not be the same perspective as a widow in the community who has several children who she's supporting. It won't be the same perspective as a youth, for example, who probably was taking care of his father's livestock, and now they have all been decimated in the drought, for example. And maybe at that point he never went to school because he was taking care of his father's livestock. So all these perspectives are very different, and how you support these people is also very different. Yeah, it's not a one-size-fits-all kind of response, and that's why having a very gender transformative kind of perspective when setting up these kinds of programs and understanding the unique needs of each of these different groups that I've mentioned and that you mentioned is very important before setting up a project, before going full throttle with it. And that's partly where the work of AHN comes in as well, because they are at that level of the community and they understand the different needs. They also understand some of the cultural differences within these communities and what can make some of the members of these communities even more vulnerable because of the cultural practices, because of their situation as well. So it's very important that you get it right from the assessment level, yeah, before coming up with the kinds of before coming up with a project to support these communities. Otherwise, you get it wrong, and whatever you do will not have lasting impact.
Okay, speaking of a lasting impact, before I invite you to give your final remarks, perhaps, Ahmed, you can tell us how much of a consideration is project sustainability?
First, the key aspect of localization, which we were talking about and trying to push, is trying to make sure that the capacities exist at the community level and also at the local partner level. However, a local partner's capacity can only be sustained through a multi-year financing mechanism, or in a mechanism where there's going to be what we call an overhead. So we are pushing an agenda called localization, which means if we get the resources and use it for the leveraging perspectives and keep those capacities at that level for a longer period, then it's easier to be able to continue doing this work without so much. So in essence, the INGOs like Oxfam and others in time should be able to be working themselves out of work. We too should be working ourselves out of work. For example, if government had stepped in and it was just about accountability and other things which we are doing instead of gap filling, then it means our roles will have changed. So until we reach a level where that kind of an approach really works, then local actors normally get short-term financing. So you bring on board a number of staffing, and then because the project has ended, then you lay them off. So the capacity that is being talked about being built is not sustained and retained. So there is really need to really look at it from a perspective that any project that is coming has that kind of ingrained processes into it. So we push a percentage which the local actor can use to be able to do audits, to be able to do governance meetings, to be able to push on all those things. And then secondly, to be able to even build their own way of really looking at it. And it's good that we have come now with the PPO Act. The PPO Act now allows local actors to be able to really do something that is not for profit, for the purpose of doing business, but for the purpose of sustainability. So the regulations and the processes that are ongoing at the PBO processes, we are part of it, and we are pushing that agenda to ensure local actors can also be able to be part of that processes to build the sustainability components as ingrained in the funding mechanisms.
All right. Lastly, Bessie, a lot has been said in the last half hour. If there's one thing you'd like to remain with us and to leave an impression on, what would it be?
Kenya is a resilient country. Kenyans are resilient. And we have beautiful policies in place. We have very good technical capacities in country. There's a lot of need. Still, there's a lot of need. But we have the systems in place to be able to deal with the gaps and the issues that we have. To do this, we need a lot of political goodwill to be able to implement these beautiful policies that we have so that they don't stay in cupboards and gather dust, yeah? So
you influence policy?
Yes, we do influence policy. And one of the major things that would really influence the work that we do is passing the disaster risk management bill, yeah, that is currently being discussed and has kind of met a lull in the past couple of months. This would set a very good legal framework and foundation for all these other policies and all these other funding instruments that we need to put into place so that we can better the humanitarian space. So if there's anything I could say is that we need that political goodwill to be able to move things along. And I think if we do this humanitarian reset right, we'll be able to achieve a lot for our citizenry.
All right. Ahmed, your last word.
First and foremost, and as I started off, the ASALs are supposed to be the future of Kenya. And with all the land fragmentation happening in the highlands, so-called highlands, which now also are facing droughts and other things because of climate change, when a crisis hits that space, it will really affect the Kenyan economy. Just a little bit of statistics. With 90% of the land being there, with 90% of the tourist industry all the destinations been in those locations, with 70% of the livestock, which puts 90% of the meat on the table is from the ASALs. It's right time to put the right, not to forget it, and put local leadership, anticipatory action, climate smart work there, and to be able to really get stable future going forward. So Kenya must invest very well in the ASALs now and make that political decision right.
Because you mentioned climate change, financing locally led climate action program. This, basically, the government came up with it.
Yes.
Are you involved in any way?
Yes, so what we do is, when it started first, it was done through a program funded by DFID, together with the government, and it started in 5 counties. Sorry.
No problem.
So those 5 counties, that was Wajir, Isiolo, Makueni, Garissa, and Kitui, were the first counties that started off the climate change funding mechanisms. And it was accompanied as a process using DFID funding. And it was great to be able to see that model has been blown up to 47 counties by World Bank FLOCA funded. We are part of it now from a perspective of engaging civil society in it and ensuring the accountability and processes are really input into it. But it is supposed to work on community resiliency, on community identified priorities.
Okay.
Yeah, so that's how we are part of it.
All right. So, Anna, thank you. Bessie, I'll start with you. Bessie Nikosi, who is a social protection lead, Oxfam Kenya. Ahmed Ibrahim, convener, the AHN, ASAL Humanitarian Network, Oxfam partner in humanitarian projects in northern Kenya. Thank you for giving us a sense of the state of humanitarian support in the country. We take a break, but we do have more stories and the sports news coming up.